Hello and welcome to our webinar today about the CMHA Niagara and Pathstone Mental Health Strategic Planning Partnership Initiative. My name is Sarah Webster. I'm Knowledge Broker with Niagara Connects, and we're hosting the event today, and really excited to share this with you. If this is your first time participating in a webinar with us, you'll obviously be hearing my voice come through the phones, through your phone line, and please do make sure that you also click the web link in your connection details email so that you can join us in the online meeting room and see the slides from today's presentation. We do have all of our participant lines muted, and that helps us cut down on background noise, but it also allows those that are joining in small groups to have any sidebar conversations without interrupting any of the presentation. So please do know, though, when you're in the meeting room, there is a chat pod down the left-hand side of your screen, and I encourage you, if you have any questions or comments at any point during the presentation, you can put them in the chat pod there. Just type your comments in the bottom left and press enter, and we'll certainly save those and be addressing those at the end of the presentation during a discussion period. We also record all of our events, and we will be posting that recording on the Niagara Knowledge Exchange within about a week. But as someone who's registered for this event, we will also send you a follow-up resource email that will include a direct link to the recording, as well as a PDF of the slides and any other resources that are talked about today. So I encourage you to forward that on as well to maybe any other colleagues who weren't able to join us today. So I think that's it from my end. We will have a presentation for the first part of our call today. There's lots of poll questions that we've got to get some feedback from you as participants, and then we'll certainly save some time at the end for discussion as well. So I'd like to welcome our presenters today. We have Sean Bayliss, CEO of Pathstone Mental Health, George Kurzweil, current Executive Director of Canadian Mental Health Association Niagara Branch, and Tara McKendrick, Quality and Program Manager from Canadian Mental Health Association Niagara Branch. So I will now turn it over to Amanda, our consultant who's been working with the group, who will get us started.
Good afternoon, everyone. I hope you can hear me loud and clear, and thank you so much, Sarah and Niagara Connect, for hosting today's event. I am Amanda Paris. I'm a consultant with Health Innovations Group, and we have been supporting Pathstone Mental Health and CMHA Niagara with the Strategic Partnership Initiative. So I'm on slide 2, the agenda, and I hope everyone has access to this on their computers. Today, we'd like to really spend the upfront session presenting an overview of where we are today and how we got to where we are today, and then really have some time at the end for some communication and discussion with all of you on the line. So hoping for some great engagement today. So we'll start off with why integrate, why the two organizations approached each other, provide an overview of the history to date. George and Sean will talk and share the vision for the strategic partnership, the principles underpinning the process, and then provide an overview of the preferred integration model that the two boards have asked for further engagement on, which is part of this process today. We'll provide an overview of the next steps, and then, as I mentioned earlier, have an open discussion and facilitated session. And as Sarah mentioned, there are poll questions throughout the presentation that we hope that you will answer. So Sarah has done the introductions and welcome, so I'll skip through this slide. And as mentioned just now, the purpose of the meeting is really summarizing these 4 bullets to provide an overview of the rationale for the CMHA Niagara Pathstone partnership, to review the process to date, to discuss the preferred model, and to obtain your feedback on the model and the process moving forward. I'm going to pass over now to George, who's going to go over the next few slides in terms of the rationale for integration.
Thank you, Amanda, and good afternoon to everybody. It's George Kurzweil here from CMHA Niagara. And you're now looking at the slide, Why Integrate, and I'll pass the next slide over to Sean to talk in a little bit more detail. But we started this, it was actually started by the boards of directors of both Pathstone and CMHA. It was begun by an initial discussion with the chair and the respective president of Pathstone and CMHA. And with a following of meetings held by representatives from both boards, and then considering all of the issues, decided to go a little further and hire the Health Innovations Group. So that's why we're at this consultation stage here. So nothing has been confirmed, but we're at a consultation stage. Why integrate? I think for most of you, probably maybe for all of you, you're recognizing that there are system changes either happening now or in process of happening, and certainly no different from our sector in the mental health and addiction sector. The mental health reform lead agency that are being determined across the province for children's mental health, special needs strategies, even a designation of sub-LHINs. There are changes at all levels, looking for increasing coordination and collaborating on between systems on behalf of clients and or patients for their navigation. So that's a part of the overall system that we're aware of and constantly being aware of, and some of the priorities are clearly outlined there. For example, the gaps between moving from one system to another, such as children's to adults' mental health, and just the proliferation of agencies out there and confusion regarding navigation for patients or clients. We all, if you're in the social health broader sector, you know that there are minimum increases in budgets and resources. At CMHA Niagara, for example, we've been absolutely frozen for over 5 years in terms of our core budgets, 10 years for Pathstone mental health. It's increasingly challenging to provide sustainability for services, and that's certainly an issue that has come up in our discussions with our partners and our service staff, and we've been having ongoing discussions with everybody regarding service sustainability. And it's increasingly challenging for smaller agencies to maintain the demands, despite the fact that resources are going down. Demands by funders are going up in terms of accountability, in terms of just counting, just data requirements, for example. All of us put pressures on our system, despite budget cuts. I do want to stress, though, that budget was not the key motivator for our boards and our presidents getting together initially. It was service and service accessibility. Our boards are composed of individuals with lived experience with mental health and or family members, and they feel it at a personal level. And then finally, given all of the changes at the system level, the need, for example, for a better transition between youth mental health and adult mental health, easier navigation, all of those pressures, our boards decided that they wanted to be more proactive in determining their own future. In other words, perhaps do it, and it's not a fait accompli, it's not finally determined yet, but do it, or at least attempt to do it before it's done to you. So do it in terms of what is the best service for the citizens of Niagara, and that's precisely why the boards are leading this. This is not led by staff. Many of you know, for example, I'm retiring in June, and you're all welcome to my breakfast on June the 16th. But a little advertising plug there. I'm going to pass it over to Sean now.
Thanks, George. Several months ago, there was a concept of proof working group that got together, which was comprised of staff, managers, the HIG group, and basically began going through a process of looking at different aspects of a potential integration model. And what they came out with was what would be the expected impact with such an integration. And as you look at number 6 slide, we'll look at clients first, and because that is the focus, as the reason for this is even being considered. So what they looked at, what were some of the programs they could immediately look at that could be helpful to be able to help Niagara as a whole, and one was the integration for the transitional age youth, also walk-in service, and parents of youth access to adult services, because a lot of the parents of the children at Pathstone have mental health issues, and there isn't that clear pathway with regards to them having that expertise that could be helpful to them. The other thing they noted was that there's the culture at the children's mental health center compared to an adult mental health center. There's a different feeling or connection or programmings that are different. So for a youth going from Pathstone to an adult, it is quite a transition in of itself of culture. And so what we were looking at is the change in culture to create a seamless experience, that if there was more of a blending of that piece of it, it would be in their best interest. And it looks like we'll set up a system that every door is the right door. The second expected impact was on staff. We had a conversation this morning with staff with regards to the opportunities for learning, because the adult sector have certain expertise working with their clients, as the children's sector professionals have an expertise, and so they could actually do cross-training or consult one another to be able to assist each other with families that have multiple challenges that may be happening within the family setting or with their child. So we feel that that would be helpful in that spectrum aspect. A greater ability to influence the client's journey as well, with regards to having one culture working towards the amelioration of helping them out with their challenges. The third section we're looking at is the funder alignment. We have both been in contact and have had several meetings with both the LIN and also MCYS, and they are supportive of the concept of some form of integration. And what we're doing at this point is building a business case to present to them as well for their consideration. And the fourth one we're looking at is leadership. So it would be a focused, integrated leadership. So it would be the opportunities for innovations. That is much easier to do when it's under one umbrella than working with two separate agencies. It will strengthen the lead agency application that Pathstones will be applying for in the next month with the ministry. And this gives the platform for the integration and partnership and other partners as well to solidify the existing roles that are there. The fifth one is efficiencies. There may be more funding opportunities in the future. What we do know that seems to be a trend is that those organizations that have integrated, they seem to get more funding as it relates to new programming, and so that could be advantageous to Niagara as well. And it will improve sustainability. And the other aspect, which is typical with types of integrations, is that back office efficiencies. So that gives you the expected impact that could happen from such an integration, as it will be described in the future slides here.
We'll turn it over to Amanda now.
Thank you. So just to provide you with some background and where we are today and where we hope to go, Slide 7 provides a timeline as well as a story of where we've come from to date. So in February of 2016, so nearly a year and a half ago, the two boards came together to start discussing collaboration, and collaboration across the continuum. So, really in the exploratory phase of what could working together look like, and really looking at it from the client's perspective. The boards decided to create a board integration task group, which has around 6 to 8 representatives from each agency formed to further explore and have a vision. There were a number of visioning sessions to really think about what the future could look like in terms of that collaboration continuum for the two agencies. It was determined that consultants should be hired, and after an RFP process, Health Innovations Group was hired in November. And the process that we put forward, and Sean has spoken to this already, was to start the development of what was called a proof of concept working group. And just so you can see where we are, we're here. So we're in January, where a proof of concept working group was formed. And as Sean mentioned, there was client representatives, clinical staff, union representatives, management, operations staff, and they were led through a process of 3 half-day meetings to talk about what are some of the challenges in the current system, in the current pathways that clients go through from childhood to adulthood, and with that youth transition piece. What are some opportunities? And then if we think about these opportunities, what are the different forms of integration that can help bring those opportunities to life? So following the proof of concept working group, a report was presented in March, at the end of March, to the firstly to the board integration task group, and then to the two boards separately. And this report contained the outputs of the proof of concept working group, and concurrently at the same time, a detailed due diligence report was done, looking at both organizations from a financial, governance, and operations perspective to ensure that both boards had an understanding of each agency. And then a detailed risk register with 18 risks was also presented. Once the 3 reports were reviewed, both boards agreed on a preferred model, which is what will be presented today. Now, this preferred model isn't the final agreed model. What they would like is stakeholder engagement on the model, and this session is part of that piece, as well as further analysis on what the model would look like and what are any risks pertaining to this model, as well as benefits. So going forward from where we are today, we're currently continuing in the stakeholder consultation phase and doing further model analysis. And we will go forward to development of a business case in July and August. And then over the summer, we would, following the board's review of the report, we'll be developing an implementation plan dependent on what the agreed process going forward is. So with that, I'll pass on to George and Sean to go through what the vision and the principles are for the integration.
Thank you, Amanda. The vision was developed by the 2 boards moving ahead, and as you'll see, it's the focus for clients, and that was the as I had mentioned earlier, the idea behind Pathstone and CMHA and the president and the chair having the original discussions and the ongoing discussions have been around client service and will this enhance and improve client service. When the RFP was sent out, for example, for the consultant group, eventually hiring Health Innovations Group, their strength was client perspective. And so, for example, last night we had client feedback. We've had clients on the proof of concept group. We will continue with extensive client feedback as well as other partners, which we're doing here today. But clients are front and center to what we're doing and why the boards are doing this. So our vision is for that seamless continuum of care, something that's in many provincial documents and a need that's expressed in terms of providing good mental health care right across the continuum. A lot of times it just doesn't, it's an arbitrary decision, for example, by the ministries that Pathstone goes to age 18 and adult services, CMHA starts at age 16, for example. In terms of the client and their needs, if they have a need to have adult services, it really makes no sense in many ways to have that separation. And we do know from the research that there's a big drop-off of clients who are in need of adult services but drop off before they get there. There's a huge gap, and that's why one of the reasons why ministry documents have identified this as a priority need. The leadership, the Ministry of Health Leadership Group has identified this as one of their top 5 priorities, and certainly at the local health integration table, that's a major priority as well. So providing seamless continuum of care is important for all clients, and it's not part of our vision or our operating principles that we will be the sole providers of this. We're not even the specialists in terms of transitional aged care. The region has developed a good specialty in that area, and they do have a couple of counselors and some funding to work with that. But we certainly don't want to hinder the movement of clients. In some ways, they are now, from Pathstone specifically into CMHA specifically. We want to do everything that we can, working with all of our partners, continuing to work with our partners to support them. And it's not just about the children. It's about supporting their families, their adult protectors who happen to have mental health issues as well that we can provide support for. And the continuum is not across the typical age groups which people refer to as, for example, 16 to 24 as that emerging adult or transitional age, whatever terms you utilize. We see the damages many years later of a drop in service when they're in their 30s and their 40s, and they've been homeless for some time. They have addictions, concerns or issues, and severe mental illness, and they've had no care since perhaps leaving children's mental health services and being dropped off there. So there's a great need there, and in the long term, we may impact our future services, our adult services. On to the next slide on principles. Oh, that's me. Okay. Yeah, our principles are that clients and families are central to our integration planning, and we certainly have clients and families represented through all parts of our planning on an ongoing basis. There will be no negative impact due to this integration for client services. So the hope, of course, is to enhance, increase, provide additional support, but not to decrease the level of support that both of our respective agencies already provide. Any savings achieved will be used to maintain and strengthen services, but we're not. This is not about cost savings. The boards did not engage in this in cost savings. There may be some efficiencies that are as a result, but that's not a primary motivation factor for this. Children and youth services both have a voice, so we're very cautious and careful as we move along that the adult sector and in this CMHA in this case and Pathstone Children's are both represented equally. We have something equally to contribute, and in fact, I believe that in the blending of our two cultures, if that happens, we will enhance services and learn from each other. We both have something very important to offer, and different modalities of service that can enhance both our services equally. Staff consultation, that's without question. We just did our second staff consultations this morning, as Sean mentioned, and all of our stakeholders. So one of the reasons we're doing this webinar, we have had face-to-face meetings with the children's sector directors or agencies directly related, and we've had face-to-face with the adult and addictions, mental health and addictions adult sector, which is 16 agencies at the network table, including the hospital. But then we felt the issues of mental health affect all of our variety of services or educational institutions like Brock and Sheridan, I was going to say Niagara College. And so we needed, without having like 15 or 20 meetings, separate meetings, or a large group meeting, what's an efficient way to do it? And that's why we came up with the webinar. And we're hoping, through polling questions, that this is a good way to reach out, and it doesn't take up much of your time as well. So that's all I have to say on the principles, and we have some polling questions. So the first polling question is, I understand the vision and principles guiding the proposed integration between CMHA Niagara and Pathstone Mental Health, yes or no? So if you can enter your polling answers now. Sarah, any guidance here?
Yeah, so it looks like we have 93.5% saying that yes, they do, and a couple people who are maybe a bit unsure now. So perhaps as you go forward, some questions will be answered, but certainly for anyone that has questions about the vision or principles, if you want to put them in the chat pod, and we'll make sure to address them during the discussion.
Okay, all right. Okay, and you'll alert us to any questions that we need to respond to. All right.
Absolutely.
So the majority of you do understand the vision and the principles. That's great. So on to poll question number 2. I support the vision principles guiding and proposed integration between CMHA and Pathstone. And then you're to choose from the Likert scale here: strongly disagree, disagree, neither agree or disagree, agree, or strongly agree. So one of those 5 on the Likert, if you can make your decision, and we'll see what the polling results show to support the vision and principles guiding this proposed integration. And again, it's proposed. Nothing's confirmed till the board finally reviews it sometime in September.
I'm just giving a second here for people to answer.
Okay. And we will also be taking up all of the responses that we received from this webinar and presenting these once again at the Niagara Connects seminar, which is coming up, and I don't have the date in front of me, but
June 14th.
June 14th? Okay, thank you.
June 14th, and we'll certainly provide a link for registration for those that are interested at the end of the webinar today too.
Okay, so you'll have a chance for more discussion at that point there. So mostly strongly agree, some that agree. There's no disagree or strongly disagree. So no problems with the vision statements. And thank you for responding to those polling questions. And we'll go on to the proposed integration model now, Sean.
I'm going to go step by step so that it creates the foundation for the next slide specifically. So when we use the word integration, even at the working group proof of concept, it's basically, we know it has different meanings, but we looked at from the spectrum from one end of collaboration to full merger. So, and then there was programs in between as to where do we actually land on that spectrum. So the board integration task group, again, as George said earlier, it's a combination of representations from both boards. What the recommendation was to examine a staged approach to integration. Number 2, this will allow for more integrated decision making between the organization. And 3, allow us time to change to be managed. And the reason why they've taken that sort of approach to it is that it was really, again, from staff and from family members, and that they thought that they didn't want this to be a rushed process. In the past, there's been mergers that have happened both on the adult sector and the children's sector in Niagara, and they felt that in the past that it was a decision was made, but there was not a sense of inclusion or buy-in with everyone there, and it was the staff that suffered greatly from having to make that adjustment. So with those recommendations in mind, what they thought would be is to start off with, in the first phase, to be 2 organizations that would be separate. However, the board and the management team and back office would be the functions that would begin the process of merging to become one. The management team will begin planning for integrated systems as we described earlier, with regards to having a focus on crises, the urgent walk-in services, transitional age youth, and dealing with the parents with mental health challenges, and that we look at all the programs to ensure that they were evidence-based as well, and a sense of coordination between the 2 organizations. Staff will continue to be employed by the separate agencies, so we'll keep two separate entities. And the subsequent phases may move towards a full amalgamation of agencies as we work through a business case and a work plan for those other stages. So what George is going to share with you is in the next slide, we'll identify the proposed model as to how it would look in stage one. And it's designed in such a way that gives clarity to be able to see it on a visual level.
Thanks, Sean. Yeah, and again, it was, as Sean mentioned, it was feedback from the proof of concept group that maybe you're moving too fast. We want something that's kind of middle of the road, test it out. So we came up with a two-phase or a two-stage model. And stage one being what you see in front of you, and I'll explain it again a bit as well as we can know it and detail it. And stage two, after a year, 2 years, 3 years, maybe full amalgamation. And none of this is a fait accompli until the board has received a full report from the Health Innovations Group, our consultants, sometime in September. Whether to move with these models, whether to not move with these models and stop the whole show, or they are the decision makers and the leaders for it. It's important that this be led by the board. The board represents the citizens of Niagara, so they have to speak for the citizens of Niagara. They're not paid to do what they're doing. They're here to benefit the system as a whole and not be parochial to one particular agency or another, and that's how they're operating. In any case, this is the proposed stage one model. We've already had some feedback on from our various sectors, including our clients. We would keep two distinct legal entities, CMHA Niagara and CMHA Pathstone, and two distinct staff. There are two unions. One is QP and the other is OPSU, separate staff and separate programs. There wouldn't be any dramatic changes to programs other than if we see opportunities for enhanced services or cooperation, just like we do now anyways, with our various partners, then we would engage in that and make services better, particularly when it comes to transitions. And we could learn from each other, and we would share training, etc. Where the integration at this level would happen would be at that middle level where the back office, the CEO, the management team, that's where the integration would happen at an operational level. Having said that, both the boards would be working closely together and would try to integrate their committees as much as possible, but still retaining separate, as legal entities, separate boards, separate agendas, that kind of thing. But perhaps joining on strategic planning, shared strategic planning for this stage one model. The CEO, and that's often a question of how is that determined. Sometimes you have the best vision and mission and ideas for integration, but sort of reality and jobs interfere in the process. So the opportunity is not there from a practical perspective, and that sometimes causes a barrier to integration when you know that that is the best thing that could possibly happen. Well, in this case, the history was that there was an announcement that previous CEO Ellis Katzoff had retired from Pathstone, and I had discussed with my board and to my management team as well that I would be retiring in a few years. And so there was a vacancy at that CEO level. And the idea was that when Pathstone needed to hire somebody to replace the previous executive director, that unbeknownst to the applicants, they would approach that applicant and successful CEO, which is Sean, with possibility of leading amalgamation talks, and if they were to come to full end of amalgamation, that he would be the CEO. So that's how Sean landed on that. It was a board decision to pursue their hiring for Pathstone in that fashion, with the support of CMHA board, of course. And as I mentioned, I'm retiring June 16th. Tara, who's here, who's not allowed to speak until I leave, will be replacing me. She's the quality manager, and she will be the interim CEO. And the reason she is the interim CEO is because there's no decisions being made yet at this point in terms of separate agencies or combined agencies. In any case, that's the model we have, and we have engaged management and administrative staff, payroll, personnel, et cetera, in discussions in terms of developing a model, a proposed model for the board, because the board wants to. The boards are traditionally very conservative, and so they should be. They don't want to take on any more risk than they feel is necessary, so they're examining a proposed model to see as a part of their decision making for the final vote on it in September. So that is our proposed model. I'll reiterate, two separate agencies legally, but operating at a very coherent level at that middle ground, the CEO, one CEO, the managers from both agencies, the managers of programs, and the back office management and staff working at an integrated level as well. And children, youth, and adult services, by and large, I mean, they'll be doing their own thing. They'll be doing the same thing. There'll be the same kinds of services coming out of Pathstone. There certainly won't be less services, and the same type of services coming from the adult sector at CMHA. So now we move on to poll number 3, features of proposed model. And we ask for your support here. And there are a number of features here. This is a phased approach to integration. So this is phase 1 and a phase 2 total merger. It comes from feedback from the proof of concept group, which included clients, union members, staff, family, who said, hold on there, take it a little bit easier. So that's where that phased approach comes from. So we're listening to the groups that are, the individuals that are consulting to us. Pathstone, Mental Health, and CMHA Niagara, once again, continue as separate entities. Integration of the management and back office, as I mentioned. Integrated planning. And the integrated planning is we've already initiated crisis, urgent, walk-in services, transitional aged youth, and for parents with mental health challenges. We started some of the talks. I guess the most concrete thing that we've come up with for now is in June. We haven't firmed up a date yet. Our newest walk-in counseling service will be located at the new Pathstone location. There is a potential for full amalgamation in the future, but it's not a fait accompli. It depends on feedback and consultation. And then all of the above and none of the above. So those are your choices. If you can vote with your fingers, please. Not you. Not Sean.
And it looks, George, like we've got 54%, 55% saying all of the above, and then certainly in the 40% range choosing some of the other services or other factors that you have listed there. But nobody choosing none of the above.
Okay, all right. So good feedback. Support for phased approach to integration is 48%, so half the group there. Okay, pretty good. Agencies stay as separate, so about 17%. Yeah, that's an interesting point, and one that we want to explore more. There's, frankly, the separate agencies. The issue has come up most distinctly amongst other LIN-funded addiction and mental health agencies. I don't know who's on the line here, so I don't know who's responding to that. But there's a fear of a large agency, particularly in mental health, maybe absorbing the resources, perhaps not being a good partner, those kinds of issues. And that's an interesting one to explore. I think a higher profile could bring resources for everybody. And there's certainly a strong commitment and proof from both Sean and I that we will continue to be our partners as we always have been, and to even strengthen that partnership. And integrating management back office, a lot of support for that. And services targeted for integration, about 55%. Okay, any other comments, Sean, that you had on the poll there? No?
Well, the next poll is, do you have any questions?
Okay, so the next poll is, do you have questions on the proposed integration model?
It's Amanda. Maybe there are some questions I see on the question panel. We can either answer these now or do it during the discussion phase.
Why don't we move on and go on and do that during the discussion phase?
Okay. And there is one question I see here as well.
Oh, okay.
Has anything similar been done in other communities?
Has anything similar been done in other communities is a question. And yeah, it's happening all over the province actually. As I mentioned before, it's being done either voluntarily or sometimes half voluntarily and in a variety of ways, or even just from pressure points for agencies. So it is happening. The most similar example, and at Kingston was a large 5-agency integration, London, CMHA, and Watch, which is a large integration. But the most similar one to us is Waterloo Wellington, and that was a children's mental health agency, Trellis, and they are a lead agency as well, or became a lead agency after merger, I believe, and they merged with a smaller CMHA adult services. Trellis operated, or does operate still, developmental services, children's services, and the CMHA was adult services. So they merged and became a CMHA and a lead agency for children's services. So that's our closest example. And in terms of the lead agency aspect, but there are mergers and amalgamations all over. They're happening now, and they have happened, and we have consulted, the board has consulted with a variety of agencies leading up to their decision to pursue an RFP and hire consultants. So taking the information from those that have lived through it. So yes, absolutely there are examples there. Any other questions? Dana?
It does look like there's some more questions that have come through here. I can't read them on my end, but Tara, it sounded like you could there. Otherwise, we can summarize them at the end.
Yeah, maybe we could summarize them at the end and do a question and answer period.
Mm-hmm. Sounds good.
Okay.
Okay, then it's Amanda. So Sarah, can I just confirm, if I move on, we're not going to lose those questions?
No, not at all. It's saved in the back end of our program, so we can certainly come back.
So we can come back to them during the discussion phase?
Yes, I'll try to pull them up here.
Great. And can I just check, do I sound clearer now?
Yes, you do. Thank you.
Perfect. Thank you, everyone, for the questions, and we will get back to them. Just to summarize in terms of some of the next steps, and we have talked about many of these already, but we are in the consultation and engagement phase. So we have had meetings with unions, 2 sessions with staff, an anonymous survey with staff from both organizations, and feedback from that survey was presented back to them today. We've engaged with partner organizations face-to-face, and as we are doing now over this webinar, as well as with unions and the funders as well. So the input is all going to be used to shape the integration model and the report that is going to be presented to both boards. Sarah, I believe, will be presenting some more information, but we will also be presenting the findings of the stakeholder engagement phase at the Mental Health and Addictions Charter working session on June the 14th of 2017. Then the next step will be that the board integration task group and then the 2 boards separately will review the feedback from the engagement process as well as the analysis and recommendations on the preferred model. The boards will receive this feedback and make a final decision for each organization on how they will move forward. And then a business case will be developed and presented to the LINS and MCYS to obtain their approvals. So those are the overall next steps in terms of where the process is going. So the final 50 minutes we really want to spend on the discussion and the questions, of which we have had many come up already.
Yeah, so when we go back to that poll, maybe I could start off with a comment that we've had in the chat pod. Joy says, so in stage 1 of the integration, would all of the people currently serving each agency, example, board members, managers, et cetera, continue to function in those roles as they always have? If so, other than one CEO, what would demonstrate or operationalize the integration of those services? Basically, before I support the integration of back office and management and agencies staying as separate entities, I want to hear more about what that first year or so of integration might look like.
To begin with, when you're looking at this integration proposed, we'd be looking at initially where the board of directors would be having conversations with regards to their bylaws, with regards to getting that uniformed. We'd be looking with staff, particularly with the managers. They will continue with the teams that they operate and continue on, so there is very minimal change in that, but we'd be looking at other opportunities as a management team as to service those areas where there are gaps within our systems or between the agencies. So that would be the primary focus on that end. The other part we'd be looking at is managers helping out with regards to the walk-in and the crisis services to see where we can increase capacity building and coverage for that aspect of it. So they would be more of those type of conversations. As I said this morning to the staff, was that you will be still reporting to the same managers, the same expectations, the same standard of care. So the first year you're really looking at that piece of integration of the management team getting connected, and then you have your board beginning to be defined and develop a strategic plan as to how that will come together. The other part that's important that we thought would be helpful in the integration, and it was really from the ideas from the staff of the CMHA, have invited that we should have time where our staff have presentations and information session with regards to the different types of programs to give them that sense of awareness of what's there, and also have some socialization within that so that there's that sense of connectedness where they get to know each other as well. So there will be a strategic plan with regards to incorporating all those different types of concepts to start off on that integration piece. George, you want to say anything else?
Yeah, I mean, in terms of the back office functions and all of that, I mean, there we see this. I see efficiency as specialization, and so I see some efficiencies gained. So yes, there will likely be changes because you don't have 2 financial directors, for example, but you do have you're still serving the same population of staff and clients and the same numbers, and the workload is still there. At the back office, we operate pretty lean as it is. So if you're asking specifically, will there be reductions? we don't anticipate that, although in the case of a large merger like Waterloo, there was, and I'm just trying to recall from memory, one person back office left, another person in early retirement, and perhaps another one. And they're an agency of 400 staff now. They were 300 when they merged. But so there won't be that, don't anticipate that kind of a job loss. But yes, we anticipate changes to how people perform their roles, or perhaps different roles within the back office, the payroll, the HR, IT, that kind of a thing. And of course, there'll be one less CEO, so there's a huge cost saving there by the getting rid of that CEO. That's a joke. We, with the increased accountability needed, in particular for quality measures, we will enhance the quality manager position, or we're looking at making that at a director position for quality of operations, et cetera. That's increased pressure from all funders really for higher reporting in that area, and greater efficiencies, better evidence-based practice, outcomes measurement, all that. There's just so many demands that in our smaller agency we can't meet, but with putting together our resources, we can develop specialties in the area and be better at delivering that kind of services. So at that middle ground level, yeah, there will be some changes to the nature of jobs that people are doing.
And I think the other part to help in the seamlessness of the integration is that we have the different specialties or expertise from both agencies, whether it's the financial or human resources. They're having conversations as well as to what is the best way to how to make this look, and what roles they can play and be supportive to each other because of the expertise. So a good example is that our our manager in finance, she specializes with the MCYS, and there's a lot of documentation and reports that have to be submitted quarterly, and it's the same with Canadian Mental Health Association, that their manager of finances have the same expectations with their ministry. So it's something where those positions would maintain those roles, but maybe there's something because of the administration piece that we can download some of those responsibilities to administration staff. So they're having conversations to develop what that matrix or that structure looks like, so that it's actually a collaborative process that will take place between those different units.
Wonderful. So I do see we have a few more minutes here. I'd like to address, maybe ask a couple of the questions that were submitted through the poll. But what I'll propose is that those questions we don't get to, Sean and George, if you're comfortable with this, if I can send them to you and we can work on some written answers over the next week or so, we could send that out in the resource package to all participants so that we do make sure that all the questions are addressed.
Absolutely, and we'll incorporate it into the seminar that's coming up on June 14th as well.
Great, thank you.
Sarah, it's Amanda. Is there a way to see those questions?
Yeah, if you go into full screen mode, and then as you hover over the answers, as you scroll right and left.
Okay.
Yeah.
Thank you.
So maybe I'll just put one of them forward here while we've got a bit of time, and that's how are community mental health services from the region and NHS mental health being integrated into the service delivery model?
From NHS and Niagara region, how are they integrated
into model? Well, I mean, we continue to work as partners. CMHA sits at the table, at the network table of including those and 13 other partners, and we will continue to do that. That's not going to change. We are integrating integration, as was introduced at the beginning by Sean, can be various levels. And so, for example, with CMHA, the region, and Gateway right now, we're having discussions about one of our biggest resources, which is case management. We have 26 case managers at CMHA. The region has, I'm going to be guessing, but anyhow, they have maybe 30, and Gateway has about 14 or so. So that's a large resource for, I'm just guessing at those numbers. I can't recall right off the top of my head. We're looking at how to better allocate those resources and do that cooperatively and specialize in the kinds of case management that we do. So that's happening right now. We're comparing data. We're developing strategies to integrate. Of course, our greatest integration, which I'll give really a lot of credit to Sean for getting going, is the access line, that 24/7 access line, which if you are an adult with a mental health and addiction need, you can call 24/7 to one number that's run by the Stress Center of Niagara. You can call one number and you'll get a warm transfer to Community Addiction Services of Niagara or the region or Gateway or Wayside, any number of programs across the region or the hospital that service this population. So we continue, and we will enhance and work further at the children's level.
Yeah, I think too is that Niagara is very unique, that we have really positive, I think very collaborative relationships on the high level where there's conversations taking place. But I can give you two examples when you're talking about, let's say, regional Niagara and also NHS. So right now there's conversations that are occurring with Pathstones and also with the Niagara region and Canadian Mental Health Association, and there was a number of others there about transitional age youth. And we know that Niagara region is going to continue to take the lead with regards to that transitional age youth aspect of it, and we're going to be meeting in September, so that's something that's ongoing. Another one is with the children's side. NHS, Pathstone, and Contact Niagara have been in, actually we're having another meeting coming up next week with regards to talking about care pathways and the allocation and where children should be referred to, and working very closely with each other to have one system. So they have been ongoing, but this will just continue to enhance that which has been established, and we will continue with that approach in the future because Niagara is very cooperative, and they are very good at having partnerships that will make things easier or to increase capacity building. So we're a very, very exciting area for Niagara. I think we're going to take a major lead and an example to other regions in the future as we move forward with this type of approach and attitude.
Wonderful. So as both Sean and George have identified, what we have today and this conversation we've had today is part of a larger and ongoing conversation that's already started and will continue going forward. So unfortunately, we are at 2 o'clock and we do have to wrap up. However, please know that those questions that you posed through the poll, we will work with presenters to make sure that those answers are provided back to you, and that'll be shared in the resource package with a link to, as I said, the slides and the recording itself. We do have one final poll here, so if you can take another minute or so to answer, and then we'll put up a contact slide at the end. While you're answering, we've talked a little bit about the June 14th event, and that is a working session to advance implementation of the Niagara Mental Health and Addictions Charter. And during that, we'll hear further results and a summary of the feedback from all the partner input during all these sessions, as well as it's an opportunity to look at embedding charter principles into your own strategic planning at your own agency and creating a structure to learn together through partnerships and shared measurements. So Sarah's put up in the chat pod there a link to the event for more information if you're interested, and through there you can look at how to register. It is a free event, but please do click through if you're interested, and we'd love you to continue to be part of this conversation. Just going to move ahead here to the final thank you slide with contact details. For those of you that are already part of our Niagara Connect network, as you'll have seen this week, a communication come out. We are looking at keeping our distribution list as up to date as possible. right now our Knowledge Broker team adds at least 15 new events, resources, partners, and community blogs to the Niagara Knowledge Exchange each week. And we share that back through our weekly e-blast. If you'd like to continue to receive that communication, or if you're not yet on our list but would like to be going forward, we've also put the link there in the chat pod. So please do consider signing up. And if you're already on our list, please do know that you have to click the link and complete our new and improved sign-up form to make sure that to confirm with us that you still want to stay in touch. So other than that, we'll wrap up there. When the meeting room closes, you will be redirected to a very short survey. We really appreciate all of your participation today and engagement. And that survey is for us on Niagara Connect side of things, just to make sure that the type of opportunities and learning events that we're providing to you are meeting your needs and expectations for quality information. So please do take a minute to fill that out. And certainly if you have any further questions that you haven't been able to put forward, or you go home and start mulling things over, don't hesitate to reach out to Sean, George, Tara, or our team at Niagara Connect, and we'll certainly do our best to get the answers to you. So thank you to all of our speakers today and to everyone who took the time to join us. Have a great afternoon.